Hello. This is Pathophysiology tutorial. Today's topic is kidney, but unfortunately none of the student is here. As I see, got high marks in midterm and they don't think that they have to attend the tutorial. They forget that we have second midterm and we have the final exam soon. As always, I have prepared presentation. My plan was for today to start the presentation with questions about blood cell disorders, true or false type of assessment, and then start talking about the kidney. But nobody seems here. Come to here. Let's wait for them. If they don't came, I'll record anyway. I'll speak about kidney disorder. I'll wait for a few more minutes for my students, but before they will come. Hello, Solomon. How are you?
Fine, how are you?
I'm okay. I was waiting for you. First of all, I want to ask about the last midterm. As I see, you got quite good marks. Even I was not expecting that high marks. How's the midterm? Or what do you think?
It was good, it was okay.
It was easy, right?
Not really, but it was okay.
It was okay. Okay, Solomon. But you got very, very high marks. So Yeah, and unfortunately, we did not make tutorial last week because I had the electricity issue. I was there yesterday on Wednesday. I was here, but there was not electricity, so there was not internet also. So I couldn't conduct. Then we changed the date on the Saturday, but I guess maybe that it was too early for you guys because some of you are not in Georgia. Yeah, so so we did not have the tutorial last week, and we were supposed to have. And let's see how what we will do. Maybe we will make one extra tutorial. I don't know because there are lots of chapters left, and also we are planning for finals. You have to prepare for yourself several chapters, and one more chapter. I don't think it will be that okay for you because you have to read too much for finals to review all the previous chapters and also several new chapters. So let's see. Let's see for a few more minutes for the Abid and Yazan,
Okay.
and we will start. Yeah, we have finished this very first part, very first midterm, and you got really good marks. Let's see. Let's see. But we have very important part also left, second midterm, and the final exams, and it's very important parts. Very
When
important.
is the second midterm?
Second midterm will be in 7 weeks or 6 weeks. I don't. So we was talking it to be in 15th week or 14th week. So we don't know exactly. So we will inform you for sure. So and final exams. Yeah. So
Okay.
let's see. And final exam will not be online for sure. It will be on examination room. So yeah. Okay. So um, so Abid. So today's tutorial topic is kidney. It's very important topic, very high yield topic, kidney disorder in clinical practice. Uh, yeah, because kidney disease, we have lots of kidney disease, and it's also connected to many other disorders. For example, in cardiological hospital, it's also important because patients with heart problems have very often kidney problems. So heart and kidney is quite connected. Yeah, so there are many important diseases. We will revise those diseases, and also we will speak about general anatomy. I will highlight you main points for you: general anatomy and physiology of the kidney. Okay, I don't know what should we do. It's already 12 minutes. It's already 12 minutes. Yazan and Abed. And I was planning to have, first of all, the assessment for assess your knowledge in blood cell disorder. I know that there was a question about the blood cell disorder in the first midterm, but we did not have assessment, and um, we all know that we are not preparing only for the midterms or for the exams here, but of course it's important, and you will get those questions about the blood cell disorders in final exam. But we are preparing here to become uh, for your case, Solomon, rehabilitation doctor, for Abed and Yazan case to become the nurses and to have the confidence, to have the knowledge in real practice, and when you have the knowledge, when you have the strengths, and you will enjoy your job, and you will support others really. Without knowledge, it will be just making money out from your from your profession. It's very important. We need money, but it's not only essential thing, I guess. Okay, what we do, which should we do now is I have several activities. I have several activities. So uh, you can see the slide, right, Solomon?
Yes.
Yeah. Let's do this activity. Fill in the blanks. So here the blank has sentences about cardiovascular conditions, cardiovascular things, and here are the words. So you should choose which words should be there. Um, Actually, let's start. Let's start, Solomon. Um, let's have I don't know. Guess uh, 7 minutes will be enough, right?
Yes.
Yeah. So let's start. I will do also with you, man. So I will write down, write down. I will write down, and then we will read together. Okay.
Okay.
You are in Georgia, right?
Yes, I am.
Yeah. Okay. Okay, man. I guess this one is more about cardiac thing, but cardiovascular also. So, but it's okay. It's okay. It's very important. Let me inform when you will be done, Solomon, but I am not finished yet. I'm also doing I'm on surveillance. So yeah.
Okay.
Okay. Mm. 7 minutes, but it's okay. We can continue. I am done, and I use all the word, but take your time, man. So when you will be done, tell me.
Yeah. I think we can try now.
Okay. Okay, man. So let's start. Let's start reading.
Yeah. So the dash of the okay. Do I have to fill it?
Sorry?
Like, do I have to put them now, or I just read it first?
Yeah, okay. So you should read whole. Yeah, okay,
Okay.
okay. Okay, take your time.
Is it the arteries
Okay.
of the act? No. Not which
Solomon,
one.
I guess he has a problem with the microphone.
Hello.
Yeah, yeah, but sometimes it's there's a problem. So, okay, let's start. Solomon, can you hear
Okay.
me?
Yeah, I can hear you now.
Yeah, okay. Let's start. You will read, right? But
Yeah.
read the whole, whole text and not just the words. I mean, yeah.
Okay. Okay.
Okay.
Okay. So the valves of the act is to pump blood around the act.
The valves of the heart
Yeah, I said the valves
is to pump blood around the
is to pump blood
uh-huh, around the what?
around the act,
Around the
or the chambers of the act.
okay. Okay, let's continue. I have some. I think maybe some words can be more appropriate in some cases here. But okay, let's continue. Let's finish. Let's read what did you do. And then we can correct.
Okay.
Hmm?
So the act is a allomuscular chamber divided by a ventricle um, a ventricle organ called the left ventricle, right? No, um, called the atrium, and
Solomon, you are
the
doing right now, or did you already did it?
yeah, I wrote it down, but I'm trying to make sure that it's the same thing.
Okay,
I'm
but
just trying to be sure I'm correct or not. That's why.
yeah, but I don't think you are correct in many cases. I think yeah, in many cases, I don't agree. I don't agree you. Um,
Okay, you can tell me the
okay,
correct
yeah, I will
thing.
tell you till now, and then we can make. Yeah, okay. So I think that the first one is the function of the heart. So first word is function. Second word is heart. Is to pump blood around the body. So now it makes sense. So function of the heart is to pump blood around the heart. The heart is a hollow muscular organ divided by a vertical wall called the septum. I think so. Does it make sense to you? Because
Yes, it does.
Yeah, okay. Because yeah, I know sometimes those words are quite similar to each other, and it's quite difficult to differentiate. But yeah, so let's continue, man. What do you think? These two what? Actually, what man? What can we do? You can write down and message me on the chat. I don't know, and then we can. And it's really okay to make mistakes here, man. It's really okay. Okay, yeah, I think it will be better, and then we will correct together. No worries about it. I'm thinking why Abid and Yazan are not joining us. I hope they are okay. They will watch us at least. They will message you if it's in case. Because we have very important second part left and mid and final exam. As you wish, man. You can continue from where we stop. Ah, I'm sorry, man. Yeah, I did not show you text. I'm sorry. So, yeah, here we go.
So I think the next words are chambers.
Okay. You can. Did
From
you message me?
these
Sorry.
two
Oh,
chambers.
okay.
No,
Okay.
no, no.
Okay.
I wanted to say it.
Okay. Okay. Yeah. Continue. Yeah. Chambers are true. Yeah. These two chambers.
These two chambers are divided into a thin walled um, ventricles.
I think after divided into the scene world, I scene world are the atrium, but sick world are
Chambers. Actually. because there are four chambers.
Yeah. These two chambers are further deep into the thin-walled atrium above and thick-walled ventricles below, I think. Yeah,
Ventricles.
because
Yes.
thin-walled are the atriums and thick-walled are the ventricles. Make it from okay, continue. Yeah, sorry.
Okay, so the blood vessels leaving the heart generally carry
But man, we missed one sentence. Between each pair of chambers are
blood, no oxygenated blood through
okay,
vessels known as the arteries,
known as
the veins or
arteries. Arteries.
artery
Yeah,
or veins. Yeah.
yeah. But man, we missed. Okay, continue. But we missed one sentence before the between each pair of chambers. Ah, you did read it. Yeah, chambers
Yes,
are. What did you write here?
between each pair of chambers are walls.
Yeah, walls. Yeah. Okay, continue.
So this blood vessels known as the arteries. These are large hollow elastic tubes with thick
Yeah.
muscular walls
Yeah, I think also walls. Yeah.
that are designed to withstand high pressure with blood leaving the heart. Their
Uh-huh.
size gradually
Uh-huh.
their size gradually as they
Gradually what?
um, diminishes.
Yeah, gradually diminishes or decreases. Yeah.
Yeah,
Continue.
as they spread throughout the body,
Mhm.
ultimately reaching fine hair-like vessels known as the capillaries.
Yeah.
Blood vessels that return from the blood to the heart are known as deoxygenated
Okay. So is deoxygenated.
which carry
But I think here that deoxygenated should be used here, which carry deoxygenated blood to the
blood.
heart.
Yes,
But
yes.
here you should use the other words. So heart blood vessels that return blood to the heart are known as and what word should be here?
Um, they're known as the atrium
I think it should be veins because veins
veins.
are called which return the blood to the heart.
Oh, okay.
Okay. Okay. Next, last sentence actually.
Okay, the blood is forced through the arteries by the pressure from the heart, whereas venous flow is aided by muscular contraction.
Yeah, contraction. And we also had one sentence before that. They are elastic tubes containing valves to help prevent backflow of
Backflow,
blood. Yeah.
yes.
Thank you, man. Thank you. Well done, you. Well done,
Yeah.
you. So here are the correct answers. So function, heart, body, organ, wall, septum, chambers, atrium, ventricles, valve, oxygenated blood, arteries, walls, diminishes, yeah, capillaries, veins, deoxygenated, backflowing. We was true. Yeah, well done us. Well done us. Okay, man. So now I have another activities, true false activities. So let's did that activity uh, together. So yeah, the sentences, and what do you think? Is it true or false? So could you read first one, please?
Blood is a type of connective tissue.
True or false? What do you think, man? Is it true or false?
False.
Is it
False.
false? What
Yeah.
type of tissue is blood? Is tissue at all?
No, it's not tissue.
Mm. Yeah,
I don't.
but
I don't think blood is a tissue.
yeah, yeah. To tell the truth, yeah, it seems impossible to call the blood tissue, but
Tissue.
scientists they call the blood tissue, and yeah, they called it connective tissue, man.
Oh,
Yeah, so
okay.
blood is also connective tissue, like bones, like I don't know. So blood is connective tissue. So it's okay. Here we are
Okay.
studying, man. So next one, can you read for us?
Non-living fluid of the blood is called chin.
Yeah, true or false? You can, I don't know, if you don't know, you can search. I'm okay with it because you are
Okay.
studying. You should study here. But this was also the topics you was prepare. You was supposed to prepare for meeting. But okay, yeah. So if you are not sure, you can search.
Okay. The answer is false
Why?
because it's called matrix, extracellular matrix, not chin.
Okay, it's not true yet. It's false. Okay, man. So next one. So I will read. So primary function of the red blood cell is to transport carbon dioxide. Is the primary function of the red blood cell to transport carbon dioxide? Is it true or false?
I think it is false.
Yeah, it's false, of course, man. What's the primary function of the red blood cell?
It's to the main job is to
To
take
transport.
out transport, yeah, carbon dioxide as a waste product.
Is it main function?
No, like the main job of the red blood cells
Yeah.
is to carry oxygen from the
Oxygen.
lungs
Yeah.
to the body tissues.
Yeah, I think yeah, it's main function. Okay. Next one. Albumin is the most abundant plasma protein in our body. Plasma protein albumin, most abundant. Is it true or false? What do you
It's true.
think? It's true. Of course it's true, man. Yeah. Albumin is the most abundant. Okay, next one. People with blood group 0 are universal recipients. So that means that they are uh, they they can take blood from any other blood groups. Is it true or false? Are they universal recipients or are they universal donors?
They are universal donors.
Donors.
Yeah. O,
Why?
o, you mean just blood group O or like O positive or O negative?
You mean rhesus factor? Rhesus
Yeah.
factor? They don't. They don't. Uh, they don't ask about the rhesus factors. I guess they are asking about just ABO system.
Yeah, they are
Hmm.
universal donors and universal. They are mainly universal donors, as I know.
So donors, that means that they can that blood can be given for others. Yeah. So
Yes.
so when we are talking about zero type of blood, that means of that they don't have any type of antigen, right? But that they have antibodies, right?
Yes.
I guess them. So I think yes, they are also the universal donors. So this is false. Yeah, man, you are true. So next one, microcytic anemia is characterized by small red blood cells accumulating in the blood. What do you think about it?
I think true. Can you hear me?
Yeah, man.
Okay, can you hear me now?
Yeah, man. Yeah.
Okay, I think there's a network problem, network cut off.
Yeah, it's okay. It's okay. So what do you think about this sentence?
Yeah, so I think it's true.
Yeah, man, it's true. Microcytic is small.
Yeah.
Macrocytic is big. Normocytic is normal. Yeah. So now, the next one is folic acid is a micronutrient. Folic acid. We know about the folic acid deficiency, which can cause the anemia, right?
Yeah.
What do you think about it?
Yeah, I think it is not a micronutrient.
So what is it?
Like it is a vitamin, I think. It's
Hmm.
like
But does vitamin? But do you think that micronutrients and vitamins are different terms, or they could be sometimes the same?
yeah, they could be the same, I
Okay,
think.
okay. Let's see. Okay, it's true, man, because folic acid is vitamin and micronutrient at the same time. Yeah. So it's just term. Okay, man. Let's continue. Could you read, please? Solomon, I still can't hear you, man.
Can you hear me now?
Now, yes. Okay. Can you read this sentence?
Okay. Bilirubin results from the destruction of the red blood cells.
Is it true or false?
In some cases, I think yes, because I know it occurs only like during maybe there's a problem with the liver.
Yeah. Yeah, man. Yeah, it's true, man. It's definitely true. Well done, you actually. You know this chapter because you were answering well. Okay, next one. Please, can you read?
Yes, leukemia is a malignant disorder of the red blood cells.
Yeah. Is leukemia a red blood cell tumor?
Yes, it's cancer of the red blood
Red
cells.
blood cell or white blood cell, man? Leukemia.
I think it's red blood cells.
Oh, I don't like this. Leukemia is it's not
No, no,
white.
no,
It's
it's
white.
white blood cells. Yes,
Yeah,
white blood cells. Yes.
white blood cells. Yeah, okay. So this is false, of course. Okay, so now the last one, please, man. Can you
Okay,
read?
white blood cells are produced by the bone marrow.
Mhm. True or false?
I think I know the bone marrow produces the red blood cells.
What about white blood cells?
Uh, white blood cells, they are
Take your
like
time.
um, yeah, they are produced in bone marrow. Yes,
Yeah, they are produced also in bone marrow.
bone marrow. Yes.
That's true. Okay, man. Thank you. Thank you very much for the activity. Now we can start next chapter, or should we have the break and then we start? Or what do you think?
We, we can have the break.
Yeah, yeah. Let's have a break, okay?
Okay.
And then use another 2 hours for the speaking about the kidney disease. So let's have a 10 minutes break and we will meet at 6 o'clock.
Okay.
Okay, see you. Okay, Solomon, I am back. Are you here also?
Yes, I'm here.
Amen. Okay, so we can continue. We can speak about renal system and disorders. But still, I'm thinking about Abid and Yazan. Maybe they have some kind of problems. Okay, so chapter 9, renal system and associated disorders. We will discuss, as I already mentioned briefly, normal anatomy and physiology and recent renal disorders. So keywords: kidney, hilus, renal artery, nephron, ureter, renal medulla, renal vein, glomerulus, urethra, renal cortex, and so on. So before we start discussion, my favorite part, as always, test your prior knowledge. So, okay, let's start from first. Name 4 functions of the kidney. So, what do you know generally about the kidney, man? Why do we have that organ? Is it essential organ? And what the main functions of the kidney?
I think it's to regulate pH,
Mm-hmm.
also like excretion of waste and toxins.
Okay. It regulates what?
pH, body pH.
pH. Yes, somehow, yeah. So what's the other function? What's the main function of the kidney?
Regulates the iron
Mhm.
concentration of the body,
Mhm.
and also um, it's uh, like it produces like production of hormones.
Sorry?
Production of hormones.
Hormones? Which
Yes.
hormones? Which hormones are produced in kidney? Can you give me the names? Mm, what, Solomon? One of them, yeah, you are true actually. They produce one of the most important. Actually, I don't remember others. There could be others also, but uh, erythropoietin. This is hormone which
Yes. Yes.
or
Erythropoietin and
yeah,
calcitonin.
which I don't know about. You mean the D vitamin? Yeah, yeah,
Yeah.
yeah, yeah, yeah.
Renin and renin.
Renin angiotensin aldosterone. Yeah, yeah, this system. Renin is produced in kidney. Yeah, uh, and the function of erythropoietin is to uh, um, encourage the production of the red blood cells. Yeah. So kidney and red blood cell connection production is quite connected to each other. But we did not mention the main function of the kidney. Main function of the kidney is to filtrate the blood from the waste products and produce the urine, right?
Yes.
This is the
Yes.
main
I
function.
mentioned that already.
You mentioned, okay, okay. So yeah, okay. So it's very important function to produce the urine. Yeah, yeah. Then there are also other functions. Okay. Um, so which substances are reabsorbed and which are excreted by the kidneys? Do you remember this information? Which substances are reabsorbed and which are excreted? It could be. Um, we'll speak about this. For example, urea, which is also important part of the urine, it's excreted. Waste products, different waste products excreted. But for example, glucose, sodium, potassium, and all these elements are reabsorbed. So we'll speak about this also today later. List the composition of the urine. So which parts of the urine are, what's the composition of the urine? Uh, what do you think? What's a part of the urine? Of course, main thing in urine is water, right?
Hello?
Yeah,
Yes, yes,
yeah,
yes.
yeah. And then
Is
there
it? Are you
are,
asking about the color?
yeah,
Yeah, it's light yellow,
yeah,
or sometimes it could be clear
yeah,
color.
yeah. And the color of the urine is very important to diagnose different diseases, right?
Yes.
Yeah, yeah. Okay, thank you. And the urine contains also different waste products, for example, azote, urea, nitrogen. Different substances can be found, and depends on the disease. For example, during diabetes, in urine, urine contains glucose, a high amount of glucose, because there's increased amount of glucose in the blood during diabetes. So urine also contains high amount of glucose. This is very important. Even in old uh, days, in last centuries, during when the Hippocrates, this one man, was uh, working as a doctor. I don't know. I remember that the doctors was uh, drinking their patients' urine to detect the maybe um, uh, was
For
it
blood sugar.
blood sugar level? Yeah, there was not drinking too much, but there was just tasting. Yeah, okay. So what's the color of urine? We think about the destruction of the red blood cells. Yeah, so you mentioned about the color, and the red blood cell destruction is connected to the colors of the urine. What do you think? How could be red blood cell destructions connected to the color of the urine? Do you have any idea?
Could it also be maybe when the urine is too yellow?
Yeah,
So that also affects the bilirubin.
yeah. Exactly, man. That's about the bilirubin, which makes color. Yeah, bilirubin, biliverdin, and then there are different products. Yeah. So excessive destruction of red blood cells will lead to the excessive production of bilirubin, and then yeah. Okay, let's continue. So learning outcomes. What will you learn by the end of this chapter? On completion of this section, the reader will be able to describe the structure and function of the kidney, describe the microscopic structure of the kidney, explain glomerular filtration, list the chemical composition of urine. So actually, we don't speak about only urine kidney. We will speak about ureters, urinary bladder, urethra. So this is renal system. So urine are produced in kidneys. Then from ureter, it enters up in urinary bladder, and then from urinary bladder, urethra, it's excreted. I don't know what to say. You see here. So kidney, urethra, okay, sorry, this is a bladder, and this is ureter, sorry, this is bladder, and this is urethra. Organs of the renal system ensure that a stable environment is maintained for the survival of cells and tissues in the body. Yeah, so renal system organs play a very important role to keep the homeostasis. Um, External structures of the kidney. So there are two kidneys, one on each side of the spinal column. They are approximately 11 centimeters long, 5 centimeters 6 centimeter wide and 3-4 centimeters thick. They are bean-shaped organs where the outer border is convex. The inner border is known as the hilum, and it's from here that the renal arteries, renal veins, nerves, and ureters enter. So this is the hilus here, and here you see the renal artery, renal veins, and ureter enters kidney. The right kidney is a contact with the liver's large right lobe, and hence the right kidney is approximately 2-4 centimeters lower than the left kidney. Yeah, it's okay. Then there are 3 layers which covers of the kidney. So renal fascia is outer layer, adipose tissue middle layer, and renal capsule inner layer. Okay, this is general information you see here. Okay. And composition of the kidney itself. Renal cortex, you see renal cortex here. Renal medulla here. Renal column here. Renal pyramidal in renal medulla. Renal sinus. Renal papilla. Fat in renal sinus. Renal capsule outside of the renal. Nephron, which are the unit of the kidney urine production system. Nephrons are where the urine are produced, and we are going to discuss the structure of the nephron today. Paths of urine drainage collecting that. So this is a nephron. This is actually glomerulus where the urine is produced, and this is a duct system, and through this duct system produced urine are then ended up in the papillary duct in the renal pyramid, then minor calyx, then the major calyx, then renal pelvis, and from renal pelvis, ureter, and then urinary bladder. Solomon, man, you know my strategy. So, and you know that if you don't understand anything, if you have doubt anything, or if I'm talking too quick, please stop me. Tell me I don't understand this. I don't understand this.
I understand this.
You are with me, right? Yeah. Okay. So this is generally the kidney structure. So we already mentioned the internal structures of the kidney. It's renal cortex, renal medulla, and renal pelvis. So this is renal pelvis, this is renal cortex, this is renal medulla, and columns here. Internal structure showing blood vessels. This is a blood vessel system actually here. So this is a nephron. This one is a glomerulus. This is a part of the nephron. And red ones are here arteries. This what's the color of this? This is violet. This is violent or something like this. This is the capillaries, and also there are veins. So in glomerulus, afferent arteries enter, and efferent arteries are existing from the glomerulus. So here is the structure. So renal artery, segmental arteries, interlobar arteries, arcuate arteries, interlobular arteries. I think it's too much for you guys. So just remember that afferent arteries enters the glomerulus, efferent arteries enters, and here these arteries are filtrated, blood inside of this artery are filtrated, urine is produced. This urine then travels to this system, to the ducts. Some products are reabsorbed, some products are secreted, and final urine product is produced to the end of this duct system, and this urine, final urine, enters to the pelvis of the kidney. So very important part here is that yeah, this is important. So they are talking about the nephrons here. Sorry, these are small structures found in kidney. There are over 1 million nephrons. Can you imagine, man? 1 million nephrons per kidney, and it's these structures that urine is formed. Here the urine is formed. The nephrons filter blood, perform selective reabsorption. So they first of all filtrate the blood, and glomerulus is the part of the nephron where the filtration takes place. This will be the correct saying. So this is the very beginning of the production of the urine. Then in other part of the nephron, in the ducts, selective reabsorption takes place. What that means? That during filtration, lots of elements of the blood is also filtrated from the blood into the glomerulus. But so therefore, some of these elements should be reabsorbed back to the blood. Also excrete unwanted waste products from the filtered blood. And excretion, excrete unwanted. Yeah, the nephron is divided into the several sections, and each section performs a different function. Yeah, so nephrons are divided in different sections. First of all is glomerulus and Bowman's capsule. So also known as a glomerular capsule, this is the first portion of the nephron. Is in these sections that network of capillaries called the glomerulus is found. So Bowman's capsule is the part of the nephron, and inside of the this capsule is a glomerulus. Filtration of the blood takes place in that portion of the nephron. So this is the glomerulus. Glomerular capsule, Bowman's capsule. So it's called glomerular capsule or Bowman capsule. So this one, and these capillaries are glomerulus called. Yeah. Solomon, you are with me, right? Solomon? Solomon, can you hear me, man?
Hello.
Yeah, can you hear me? So yeah, you understand everything. You are with me, right? Okay, I can't hear you, man. Yeah, there's a problem. I can't hear you, but I hope you can hear me and I'm not talking to myself. Okay.
Can you hear me?
Yeah. Okay, man.
Okay.
Let's
Is
continue.
network?
Okay. So these tubules are divided to the proximal convoluted tubule, loop of Henle, then thick ascending tubule, distal convoluted tubule, collecting duct. So yeah. Bowman's capsule, one more time. So efferent arteriole enters this Bowman capsule, then it's divided to the capillaries. This is a space inside where the filtrations take place, and then these efferent arterioles exist from this Bowman capsule. So what's considered the partial layer parietal of glomerular capsule, mesangial cell, capsular space, proximal convoluted tubule. So yeah, I don't think it's very important. So about proximal convoluted tubule. From the Bowman's capsules, the filtrate drains into the proximal convoluted tubule. The cells lining this portion of the tubule actively reabsorb water, nutrients, and ions into the peritubular fluid, the interstitial fluid surrounding the renal tubule. Loop of Henle. The proximal convoluted tubule then bends into the loop of Henle. The loop of Henle is divided into the descending and ascending loop. The ascending loop of Henle is much thicker than the descending portion. Distal convoluted tubule. The thick ascending portion of the loop of Henle leads into the distal convoluted tubule. The distal convoluted tubule is important site for. Man, I know that it seems difficult because there are lots of names, but I myself really like this topic. I like the kidney. I like these things because it's very important. In clinical practice, it's very crucial. You should know about this. You should have insight about this. So distal convoluted tubule is important site for active secretion of ions and acids, selective reabsorption of sodium and calcium ions, selective reabsorption of water, because some water should be reabsorbed. Actually, most of the water which was filtrated should be reabsorbed back to the blood. And now we're about collecting ducts. The distal convoluted tubule then drains into the collecting ducts. Several collecting ducts converge and drain into the larger system called the papillary ducts, which in turn empties into the minor calyx. From here, the filtrate, now called urine, so from collecting ducts, it's called urine, drains into the renal pelvis. So function of the kidney, filtration, regulation of blood volume, as you already mentioned, renin, angiotensin, aldosterone system, and renin is produced exactly in the kidney, so it's very important. Other regulation of osmolarity, secretion of renin and erythropoietin, as you mentioned, maintenance of acid-base balance. This, you mentioned that, sorry. Synthesis of vitamin D, very important. Detoxification of free radicals and drugs. Gluconeogenesis. So you see, it's vital organ. It's very important organ for our body. So blood supply. So approximately 1,200 milliliter of blood flows through the kidney each minute. Can you imagine? Each minute, 1,200 milliliters. Each kidney receives its blood supply directly from the aorta via the renal artery, which divides into the anterior and posterior renal arteries. Two large veins emerge from the hills and empty into the interior vena cava. So urine formation, the process are involved in the formation of urine is filtration, selective reabsorption, and secretion. We spoke about it. So this is high-yield topics. I will make questions about it. So filtration takes place in the glomerulus, and during filtration, blood is filtrated from everything almost. Okay. Solomon? Network problems. It's okay, man.
I'm here.
Okay, you are back. Okay, so I was talking about this, the function of the kidney and urine formation, filtration, selective reabsorption, and secretion. Filtration. So filtration takes place in glomerulus, and blood is filtrated. Then selective reabsorption. Reabsorptions, that means that during filtration, lots of things are filtrated. So some of them could be reabsorbed back to the blood. And secretion, any substance not removed through filtration are secreted into the renal tubules from the peritubular capillaries of the nephron. So composition of the urine. So what are the parts of the urine? And there was lots of they was asking us about this. So urine is a sterile and clear fluid. What does sterile means, Solomon?
What did you say?
What does sterile means? This word. Do you know?
Sterile.
Sterile, yeah.
It is. I think when something can't function properly.
Can what?
Can't function properly.
Can function properly. Ah, okay. Sterile. Yeah. It sometimes they say something like this, yeah, sterilization even, yeah. But in this case, when they are talking about urine, sterile, that means that there is not, in normal cases, there should not be found bacteria, so any pathogens in urine. So that means that's the meaning of sterile in this case. So there's not any pathogen in normal case in urine. It's clear fluid containing nitrogenous waste and salts. It's transparent with an amber or light yellow color. Slightly acidic, and the pH may range from 4.5 to 8. The pH is affected by an individual's dietary intake. Of course, food intake affects. Diet that is high in animal protein tends to make the urine more acidic, while a vegetarian diet may make the urine more alkaline. Okay. So this is nephron with capillaries. We spoke about this actually. So this is nephron. And so it's important to know that urine can temporarily change color depending on what you are eating. So changing of the color of the urine is not only due to different disease. Food and what we eating affects. Also, how hydrated you are. That means how many water you drink. Because if you drink less amount of water, urine will become more concentrated and it could be more darker, I don't know, more yellow. And any medications you are taking, some medications and foods can make the urine look green, even blue. So as a, I don't know, as a nurse, as a rehabilitation doctor, any kind of medical stuff, you should know about it. And if the patient said about and asks and complains about this topic, you should know that what could be the reasons. You should ask about medications, hydration, eating. Okay, so here they are talking quickly about ureters, urinary bladder, and urethra. Solomon, can you read for us what they are talking about ureters?
Yes.
Perfect.
So the ureters are approximately 25-30 cm in length and 5 mm in diameter, and they extend from the kidney to the bladder.
Yeah.
The ureters terminate at the bladder and enter obliquely through the muscle wall of the bladder. They pass over the pelvic brain as the bifurcation of the common iliac arteries. The ureters have three layers: transitional epithelial mucosa, that's the inner layer; smooth muscle layer, middle layer; fibrous connective tissue, outer layer. Urine is propelled from the kidney to the bladder by peristaltic contraction of the ureters.
Ureters. Yeah, thank you, man. Thank you very much. So, this is ureter, common iliac vessels and ureters. This is iliac vessels, common iliac vessels and ureter. Now about urinary bladder. So urinary bladder is located in the pelvic cavity posterior to the symphysis pubis. In male, the bladder lies anterior to the rectum, and in the female, it lies anterior to the vagina and inferior to the uterus. Smooth muscle sac which stores urine. As urine accumulates, the bladder expands without a significant rise in the internal pressure of the bladder. The bladder normally distends and holds approximately 350 milliliters of urine. The urinary bladder has three layers also: transitional epithelial mucosa, thick muscular layer, and fibrous outer layer. And last part of this urinary tract is urethra. Can you read for us, please, Solomon, about urethra?
Okay, the ureter is a muscular tube that drains the urine from the bladder and conveys it out of the body. The urethra varies in length and the bodies of males and females. The sphincter keeps the ureter closed when the urine is not being passed. The internal ureter sphincter is under involuntary control and lies at the bladder ureter junction. The external ureter sphincter is under voluntary control. The main ureter passes through three different regions. Prostatic regions passes through the prostate gland. Membranous portion passes through the pelvic diaphragm. And the penile region extends the length of the penis.
Okay, thanks, man. So here are the layers of the bladder. So these ureters, urinary openings here, detrusor muscle of the bladder, rugae of the mucosa, you see, this peritoneum which covers trigon, yeah, urethra. So okay, it's okay. We don't need too much information. Sagittal section pelvis showing the location of the female urethra. There's differences between female and male urethra. Female urethra is much shorter. So urethra is female urethra and much shorter to compare the male urethra. Therefore, there's much more cases among women about the urine incontinence. That's because of the short urethra. Okay, man, so we covered the basic information about the kidney, ureter, urinary bladder, and urethra. Now let's talk about the disorders of these organs. So disorders of the renal system. So what will you learn? Actually, they're asking you some topics. So it's okay. We don't need to answer those things here. Okay, we have the case. I really love this book because this is case-based book. You are studying disorders based on the case, so it's very clinically at the same time, but also pathophysiology is explained quite well. Solomon, can you read the case of this patient?
Okay, so Miss Goldstein Spears. Miss Goldstein Spears is a 32-year-old woman who presents at the local sexual health clinic with a 48-hour history of needing to urinate frequently, and it hurts when she does. Miss Spears also thinks she may have seen blood in her urine, but is not sure.
Yeah.
She says that she has never had a urinary tract infection, that's a UTI, as an adult, but had a UTI as a child.
So
She
urinary
has
tract
she
infection.
yeah she has some back and loin pain, but no vaginal irritation or discharge. And
Mm-hmm.
she takes the oral contraceptive pill and tells you it is extremely unlikely she's pregnant as she had her period last week.
Yeah. Thank you, man. So we have the patient woman who had 48-hour history of needing to urinate frequently, and it hurts when she does. She thinks that she may see blood in the urine, but she's not sure. She stated she has never had a urinary tract infection as an adult, but she had that infection in childhood. She also has some back pain, loin pain, but no vaginal irritation or discharge. She takes an oral contraceptive pill and tells you that it's almost impossible that she's pregnant because she had a period also last week, and you know this correction. So vital signs. So here she has a temperature 37.8, 38.78. So yeah, this is high temperature actually. It could be the sign of infection, right? Pulse. She had the increased pulse, 110 beats per minute. This is important also. Respiration is normal, 18. Blood pressure is also increased. It's still in normal range, but it's increased. For example, when I have blood pressure 140, I don't feel okay. So 140, 75. O2 saturation level is 97%. It's normal. So, and what about blood count in urea and electrolytes was performed? You see, white blood cell count is 16, and normal is 4 to 11, so it's increased. So pay attention, man. This woman got temperature, increased white blood cell count in blood, increased heartbeat, neutrophils amount is increased, lymphocytes is increased, red blood cell amount is normal, hemoglobin is normal, platelets level is normal, C-reactive protein is little bit increased. Pay attention about this also. Urea amount is normal. Potassium amount is normal. Sodium amount is normal in the blood. Okay, take some time to reflect this very important, very high yield case, and then consider the following. So, what other information about her clinical history would you like to know? So, what will you ask? What could so there was informations about the uh, clinical history, yeah. So, will you ask anything else? What do you think? What could be the important also to make final diagnosis? Uh, so, what other information about her clinical history would you like to know?
I'm not sure. I think just everything you wrote down.
Sorry?
I think everything you wrote down is good.
Yeah, actually, most of the information is down right down. I just, yeah, I will ask. We will go. Mm, yeah, actually, yeah. You may ask some details, but first of all, I will order some tests. I will order some. Yeah. So you have been asked to do Mrs. Pierce urine analysis. Explain why you are doing the urine analysis and explain abnormal findings. So urine analysis. That means, of course, we need urine analysis because find out the composition of the urine, and according to this composition of urine, we can we can say lots about the disease. So, what advice would you offer Mrs. Spears to prevent reoccurrence of her urinary tract infection? Of course, final diagnosis for this woman is urinary tract infection. Of course. So, what advice would you offer Mrs. Spears to prevent reoccurrence of the UTI? What's a way to prevent? I think yeah.
I'm not so sure. Like, I just think you just have to prevent, because I know urinary tract infection sometimes could be like using unclean toilets, maybe
Using what? Using
unclean toilets.
clean toilets, yeah. And
Yeah,
also
like to
condoms,
maintain it, to
right?
maintain.
During
Yeah,
sexual
yeah,
intercourse, using
yeah,
the condoms
yeah,
to also multiple sex partners could be the risk factor. Also,
and a good hygiene.
good what?
Hygiene.
What does it mean?
I mean, like to be clean always. A good
Ah,
hygiene, hygiene.
okay, yeah, yeah. Of course, yeah. Yeah, man, yeah. So outline a plan of care for Mrs. Pierce. So of course the medication and antibiotics, right? But first of all, actually, you're not sure. You may not need antibiotics if it's virus or so. You should know which pathogen is actually the reason of this urinary tract infection, and then, of course, the specific medication for this pathogen. Okay. Here we have lots of disease actually left. Oof. I have lots of things here left. Time. Okay. Here they are talking about pyelonephritis. Pyelonephritis is the inflammation of the renal pelvis and the functional unit of the kidney nephron. But it's more commonly they are talking pyelonephritis when they have inflammation of renal pelvis. So you remember the structure of the kidney, right? So it's inflammation of the pelvis. Pyelonephritis, very important. Inflammation of the pelvis. The patients with pyelonephritis have a pain. Sorry. So it involves the cortex, which is called the parenchyma. The incidence is higher in women than in men. There are two main types, acute and chronic pyelonephritis. I guess it's more common in women because of the short urethra. I'm not sure, but why is it more common? I think it's still connected because of short urethra. And there are two types of pyelonephritis, acute and chronic. Acute, and we know about this acute and chronic pyelonephritis. Acute one is which lasts several days, but if it continues, lasts more than, I don't know, several days, several weeks, it's called chronic. And what are the symptoms of the acute pyelonephritis? There is a sudden or severe infection of the kidney by gram-negative bacteria. For example, it could be Escherichia coli or Proteus mirabilis. Gram-negative bacteria are those that don't retain crystal violet after alcohol wash. They may have a red or pink color. They usually ascend from the lower urinary tract from urethra or urinary bladder. In men, prostatitis and prostatic hypertrophy causing urethral obstruction predisposed to the bacterial infection. So in men with prostatic hypertrophy, then this prostatic infection can compress the urethra, and because of compression, urine will be accumulated, and accumulation of urine may lead to the infection. Yeah. Acute pyelonephritis can be caused by blood infections such as septicemia. Yeah, so if the patient got the septicemia, so blood infection generally, from blood, the pathogen can end up in the kidney also and cause acute pyelonephritis. Symptoms, very important symptoms. So what are the symptoms of the patients with acute pyelonephritis? Sudden onset of fever, of course, chills, nausea, vomiting, groin pain, hematuria, dysuria, rigor. Investigations. The following may be carried out to confirm diagnosis. Midstream specimen or catheter specimen of the urine to identify causative organism. So maybe you don't need that much information, but of course you will be the rehabilitation doctor. You need general, but it's very crucial, very important. For example, in nurses, because they will ask, and they will ask the patients to collect the urine specimen to go to the laboratory. So they should know that patients should collect midstream specimen, so midstream urine. This is very important. What do you think, men? Why we are asking patients to collect midstream specimen of the urine? Solomon?
I think it's just to check before diagnosis.
Yeah, but why midstream and why don't? So midstream, that means that they are supposed to pee, then collect. I mean, they should collect the urine in the middle of the peeing, this process. I don't know, urination. The main thing here that, for example, the first portion could found different bacteria, different pathogens, because they are going through this system at first, but then there is decreased chance to containing bacteria in second portion because it will be already washed out by the first portion. Okay, does it make sense? Yeah. So
Yes, it does. Yes.
yeah. Okay. So other investigation for the diagnosis of pyelonephritis is full blood count, and we actually it was raised white blood cells may indicate urine infection. So increased white blood cells, this is the universal sign for any type of infection, and it's true also for urine infection. Yeah, so in any type of infection, there's increased amount of white blood cell. Intravenous pyelogram to identify any obstruction in urinary tract. Intravenous pyelogram. What does intravenous pyelogram means? Let's search actually to see the pictures. Let's finish this pyelonephritis and then we will have break, man. Intravenous pyelogram. So they are injecting dye in veins, and then they are seeing the renal pelvis under the X-ray. So injection dye, and then seeing the renal pelvis on the X-ray. and see how it looks like. Yeah. So, and full nursing and medical history to identify any previous urinary tract infection and kidney stones. Cure and management. Patients with acute pyelonephritis should be encouraged to be on bed rest until symptoms of pyrexia. Pyrexia, that means that chills, fever, severe grain pain is subside. It's important to observe for report signs of pain such as restlessness, tachycardia, sweating in order to take prompt action. Intravenous fluid therapy may be commenced in the early stages if the patient is unable to take oral fluids due to nausea and vomiting. When able to take oral fluids, the patient should be encouraged to take 2.5 to 3 liter. Can you imagine? Report that a female patient should be instructed in proper cleanings of the perineal region. So you mentioned about cleanings, the urinary transmitted infections. Yeah, yeah, and uh, urinary transmission infection can cause themselves pyelonephritis. Yeah, as always, it's because of transmitted infections. Yeah, so cleanings of perineal region is very important. They should be instructed to wipe front the back after voiding urine or defecating, and advised to void urine before and after sexual intercourse in an attempt to flush out bacteria that have been introduced. Vital signs such as temperature, heart rate, respiratory rate should be monitored. Patients will need psychological support and reassurance during the course of the illness and should have the opportunity to ask questions and voice their anxiety. Pharmacological intervention, analgesics for pain, antibiotics to treat infection, antiemetics for nausea and vomiting, antipyretics to treat pyrexia. So, ciprofloxacin, which is antibiotic, ciprofloxacin increases the risk of developing tendinitis, swelling of fibrous tissue that connects bone to the muscle. This is important, or have a tendon rupture during the treatment or for up to several months afterwards. These problems may affect tendons in the shoulder, hand, the back of the ankle, or in other parts of the body. Ciprofloxacin. Now here they are talking about ciprofloxacin generally. This is antibiotic. Solomon, can you read what they're talking about, medicine management, about ciprofloxacin?
Because ciprofloxacin is a class of antibiotics called fluoroquinone.
Fluoroquinolones, yeah.
Yeah, ciprofloxacin is used to treat different types of bacterial infection. It is used to treat people who have been exposed to anthrax. Nurses need to be aware that there are special precautions when administering ciprofloxacin. Taking ciprofloxacin may worsen muscle weakness in people with myasthenia gravis, a disorder of the nervous system that causes muscle weakness and causes severe difficulty breathing or death. Inform the patient not to take ciprofloxacin with dairy products such as milk or yogurt or with calcium fortified juice. Patients may eat or drink this product as part of regular meal, but do not use alone when taking ciprofloxacin. They could, as they could make medications less effective.
Yeah. Thank you, man. Thank you. So this is very important. Not only nurses, they are saying the nurses here always, but not only nurses, generally the medical person. So now a few words about chronic pyelonephritis, and then there will be break. So chronic pyelonephritis means progress from acute pyelonephritis if it's not treated. Signs and symptoms is a fever, abdominal groan. So it's quite the same, but it's continues longer. So hypertension, dysuria, uremia, proteinuria. So it becomes more failure. So this condition may be asymptomatic in early stage and until the patient presents with renal failure. So renal failure because it cannot function properly, cannot do the functions which are supposed to do. So the investigation are same. Care management of the patient with chronic bowel is the same as for the acute pyelonephritis. However, patients recurrence of bacterial infection may require long-term antibiotic therapy. It's actually the same, but it's long-term condition. Okay, Solomon, let's have a break. And we have quite important parts to discuss. Let's have a 10 minutes break also. So
Okay, no problem.
we will meet at 19 till 7. So okay, do your break. I am back, man. Are you here also, Solomon?
Yes.
Or Solomon? Okay, here we go. So let's go through our final part of today's tutorial. We spoke about pyelonephritis, which is an inflammation of the pelvis of the kidney. We have left lots of disorders: cystitis, kidney injury, renal calculi. Yeah. Okay, so we have to hurry up. Okay. Cystitis, right? So what do you know about cystitis? Have you ever heard this term cystitis? Cystitis. It's inflammation, right? Because it's in IT. But which organ inflammation is it? Yeah, cystitis. But which organ inflammation is? It's called of urinary bladder inflammation. Yeah, okay. Urinary bladder inflammation. So cystitis is the inflammation of the urinary bladder, and the inflamed bladder may hemorrhage. So this is the most common form of urinary tract. So urinary tract infection is a general name, right? Pyelonephritis is also the example of the urinary tract infection. It's inflammation of the kidney pelvis. Cystitis is the example of urinary tract infection. It's inflammation of urinary bladder. Causes can be Escherichia coli, which is found in lower gastrointestinal tract, mirabilis, Proteus mirabilis. In women, the bacteria gain entry into the urinary bladder through the short female urethra. So, as I told you, because the women have short urethra, they make more prominent to disease. Cystitis can also result from non-bacterial irritation, such as from clothing that is made from synthetic fibers, hygiene sprays, and talcum powder. So, etiology, so reasons of the cystitis, it can be bacterial, can be because of sexual intercourse, pregnancy can exacerbate, but of course, all these cases it's bacteria or virus. But sexual intercourse, I mean, for example, one type of cystitis is honeymoon cystitis. So, very common, women's got during honeymoon cystitis. So pregnancy, rectal intercourse, urinary tract obstruction, chemicals in washing powder, nylon underwear, talcum powders, even stress. Stress can exacerbate. Of course, it cannot directly cause because it causes by bacteria or bacteria, but it can exacerbate. So investigations. mm, uh, midstream specimen urine, so for urine analysis, sometimes flexible cystoscopy. Cystoscopy, that means that to um, may be carried out, detect abnormalities. You know what does cystoscopy means? I will show the picture. So cystoscopy, actually, maybe videos.
This procedure is used to examine your bladder for any abnormalities. Your doctor will insert a cystoscope, which is a thin tube with a camera and light on the end, through your urethra and into the bladder. This inside view allows your doctor to look for causes of bleeding or blockage, or any abnormalities of the bladder and its lining. This animation shows how cystoscopy is used to study your urinary tract. Typically, you are awake for cystoscopy. Your urethra will be numbed with an anesthetic spray or jelly, and you may also be given a sedative to relax you. The cystoscope is inserted through your urethra and into the bladder. Your bladder is filled with a sterile solution, and you may feel the need to urinate. After the procedure, you are encouraged to do so. The doctor will examine your bladder for any abnormalities. Sometimes, the doctor might take a specimen of your tissue, which is called a biopsy, for further examination. Your doctor also examines your urethra. In men, the prostate is examined too. Once the cystoscopy is done, you are encouraged to urinate in the bathroom. Your doctor will usually discuss the results with you right away. After a cystoscopy, you might have a burning sensation during urination, or some traces of blood in your urine. It's also normal to urinate more frequently. These side effects should pass after a few days.
Yeah, it was really good animation. Really good one. Do you understand the meaning, man? Yes. Okay. So cystoscopy can be also found important to rule out renal cancer. So what are the symptoms of the cystitis? Dysuria. Dysuria, that means the pain during urination. Urgency of the pain, of the urination. Pyuria, that means that white blood cells will be found in urine. In normal cases, only several white blood cells can be found, just several in them. But the amount, actually, several or even not, actually this is not supposed to be found, so there will be white blood cells. Hematuria. What does hematuria means, man? Do you know the meaning of the hematuria? It has to do with blood, of course, yeah. And that means that hematuria, that means that blood found in urine. So in normal cases, we should not find blood in urine, but in this case, when it's found, it's called hematuria. So hematuria, so blood in urine, can be found also in cystitis. Abdominal discomfort. Nocturia means that urination during night. But what's the exact explanation for nocturia? So nocturia is a medical term of excessive urination at night. So excessive urination at night. Urinary incontinence can be found during cystitis. So taking ibuprofen, you know about ibuprofen, yeah, which is non-steroidal anti-inflammatory drug, which is used during inflammation, for pain, so taking ibuprofen, particularly at high doses over a long period of time, can increase the risk of stroke and heart attacks. So why are they saying about this here? Because ibuprofen could be used to relieve all these symptoms which are found in cystitis, but excessive of amount of ibuprofen, you see that there is scientific correlation between excessive intake of ibuprofen, and development of stroke and heart attack. So cure and management. So how you should cure patient with cystitis. The main objective is to identify the cause of cystitis, and then you should take care, and you should prescribe the specific medication to cure this. The patient should be advised on the importance of taking prescribed medication, information on side effects of antibiotics. So we are supposed to take antibiotics. They should know the side effects of antibiotics, such as diarrhea, vomiting, allergic reactions should be provided by the nurses and rehabilitation doctors also if it's needed. And because you are a medical person, you may ask questions from relatives, or I don't know, even your patients. Yeah, doctor, I'm taking antibiotics. I have these symptoms. Unless contraindicated, the patient should be advised to take water, fluid. Measurements of vital signs is very important. And actually, all these things are quite similar here. Similar to the care and management of during pyelonephritis. So acute kidney injury and chronic kidney disease. So kidney injury previously is acute renal failure. It's a condition in which the kidneys are unable to remove accumulated metabolites from the blood. So we are talking about acute kidney disease, acute kidney injury, or acute kidney failure when the kidney cannot function properly. So you remember when we was talking about heart failure. So when we are talking about heart failure, when the heart cannot function properly, cannot pump the blood into the circulation, we are called this situation heart failure. Yeah. So in this case, when the kidney cannot filtrate the blood, cannot make urine and do other activities, other functions, we are talking about kidney failure. So cannot remove accumulated metabolites from the blood, leading to altered fluid electrolysis. The cause may be primary kidney disease, or renal failure may be secondary from the systemic disease. Chronic kidney disease, previously known as a chronic kidney failure, is silent. It's very important. It's very common. Chronic kidney disease is very silent, developing slowly and insidiously with few symptoms until the kidneys are severely damaged and unable to meet the excretory needs of the body. Both forms are characterized by azotemia, increased amount of urea, increased levels of nitrogen waste in the blood. So acute kidney injury can be described and can be classified as a pre-renal, as a renal, and post-renal. Solomon, what do you think? What does that classification mean? So acute kidney injury can be classified as a pre-renal, as a renal, and post-renal. So pre-renal, renal, and post-renal. What do you think, man? When we will have pre-renal acute kidney injury, in which cases we have renal kidney injury and acute kidney injury, and in which cases we have post-renal acute kidney injury? Because even the name says everything. Yeah, it can be when you listen to this the first time, you don't know exactly, but even the name says. So we are talking about pre-renal when the reasons of the kidney are above the kidney. So it maybe could be because of generally decreased amount of blood, because of afferent arteries, because of the renal arteries construction, and so it's pre-renal. When it comes to the renal kidney injury, that because of inside of the kidney is the problem. For example, glomerulonephritis, pyelonephritis, damage of the kidney somehow. So inside of the kidney is a problem. But when it comes to the post-renal, that means that so outside of the renal, for example, in ureter or bladder or the urethra is the problem. For example, stone is tucked in ureter, or I don't know, there's a problem in the urinary bladder, there's maybe tumor, so and so. So this is very important. Pre-renal, renal, and post-renal. Does it make sense now? Do you understand when we are talking about pre-renal, when renal and post-renal acute kidney injury? Or you want to I can repeat it. Okay, so I will repeat. Okay. Okay. Okay, maybe they have. Okay. So, so renal causes include insufficient blood. So blood flow to the kidneys, resulting in reduced cardiac. So I think this is this summary of etiology of acute kidney injury is very good. So pre-renal, intrarenal or renal, and post-renal. So during when we are talking about pre-renal acute kidney injury, when it's not connected directly to the kidney or urinary tract. For example, hemorrhage, that means the excessive loss, that means the losing of the blood. Low cardiac output, so that means that the low amount of blood is pumped to the circulation. Myocardial disease, so heart disease can cause, so when can cause shock. So when the blood volume is decreased, heart failure, liver failure, severe. So when the kidney problems are because of the other organ systems, so it's called pre-renal. For example, I don't know how to explain. So, but main thing here is that during pre-renal kidney disease, less amount of blood is carried to the kidney. Therefore, less amount of blood can be filtrated and renal failure can be developed. But the reason of the renal failure itself is not kidney. It's because of blood volume is decreased because of different reasons, because of heart, because of excessive loss of blood, because of shock, because of liver failure, because of severe dehydration, because of severe decreased amount of blood volume in our organism. So pre-renal kidney disease, there is a problem of, kidney cannot do function to filtration of blood because of, not because of the kidney problem itself, but because of the other organ systems and because of the decreased amount of blood volume which is carried to the kidney. So when you read, I guess you will get it. Next one is intrarenal. So intrarenal kidney failure, so kidney cannot function properly because of the intrarenal problem. For example, glomerulonephritis. This is the inflammation of glomerulus. Hypertension. So hypertension, so when there's high blood pressure inside of the kidney. Nephrotoxic drugs, so drugs which affects the kidney structure itself. Bacterial toxins which affects the kidneys. Chemicals, so they cause the degradation of the kidney structures. So kidney cannot function properly, therefore develops kidney failure. And post-renal kidney failure. So post-renal means that when there's problem in the ureter, urinary bladder or urethra, that causes also problem of the kidney. For example, ureteric calculus. So for example, when the stone is tucked in the ureter, that means that it will not lead the urine to go through the ureter. Yeah? So therefore, lots of amount of urine will be accumulated in the kidney calculus, in the kidney pelvis. It will compress kidney and it will cause a kidney damage. Neoplasm, so tumor can be found in urinary bladder, can compress the urinary bladder and can cause the accumulation of the urine. Prostatic hyperplasia, the mechanism is also same here. It can compress the ureter or urethra. Phimosis. Phimosis is a problem of the penis when the foreskin of the penis cannot go through the penis and is tucked, so it can cause also an urethral structure. So I don't know. It could sound difficult for you for the first time, but I guess when you read it, Kemen, let's continue. Right? Do you have any insights at least? Do you, or you don't understand anything at all? You understand. Great, man. Okay. So investigation, blood count, urine electrolyte studies, urine analysis, intravenous pielogram, and we see what that means. Renal biopsy, ultrasound may be carried out by identification. Arterial blood gases may indicate. Yeah, so this one. And clinical investigation for the kidney failure can be magnetic resonance angiography. Magnetic resonance angiography. I prefer to search about magnetic resonance angiography. Sorry. I know there are lots of new terms for you, lots of new things, and it could be difficult to understand those. But when you listen to this and
welcome to radiologyinfo.org. Hi, I'm Dr. Elliot Fishman. Detailed pictures, or as it's commonly known, MRI.
Sorry, yeah, okay.
Welcome to radiologyinfo.org. Hi, I'm Dr. Elliot Fishman, a radiologist at Johns Hopkins Hospital in Baltimore, Maryland. I'd like to talk with you about magnetic resonance angiography, or as it's commonly known, MRA. MRA is a non-invasive test that uses a powerful magnetic field and a computer to produce detailed pictures of the major blood vessels throughout your body. It may be performed with or without contrast material, which if needed will be injected into a vein in your arm. MRA is used to examine blood vessels in key areas of your body and to identify abnormalities and disease. If you're scheduled for an MRA scan, there are several things you can do to prepare for the examination. First of all, discuss with your doctor any serious health problems, recent surgeries, and allergies. If you're female and there's a possibility that you're pregnant, tell your doctor as well. On the day of your exam, it's best to wear loose, comfortable clothing and leave any jewelry at home. Tell the radiologic technologist if you have medical devices implanted in your body, as these can interfere with the magnetic field of the MRI unit. Magnetic field is not harmful in itself. However, some implanted devices may malfunction or cause problems during the examination. Most MRI exams are relatively painless. However, some patients may find it uncomfortable to remain still for long periods of time, while others may experience claustrophobia. If this is of concern to you, you may want to ask your doctor for a mild sedative, prior to the examination. For more information about magnetic resonance angiography or MRA, or any specific questions you might have, visit radiologyinfo.org. Thank you for your time and for your attention.
Okay, man. Thank you. You understand, right, about this video? Magnetic resonance angiography. So I will not. So it's examination of the adolescents. So I will not read this because we don't have time. So what are the symptoms and signs of the acute kidney failure? Just 1 minute, I will type something. Solomon, you are with me, right? Solomon, you can hear me? Yes, okay. So what are the symptoms and signs of the acute kidney failure? So sudden onset, oliguria or anuria. Oliguria means decreased amount of urine production. Anuria means that less amount, non-production of urine, or the production of urine is during 24 hours is less than 100 milliliter. So it's almost no production. Nausea, vomiting, hyperkalemia. Acute kidney disease progress through 3 stages. So anuric, so when there is not urine production. Oliguric, when there's oliguric and diuretic, when there's little amount of little amount of urine is produced, and diuretic when there's increased production of the urine, but this is not good sign. So pharmacological interventions could be furosemide to include diuresis, antihypertensives, antacids, analgesia for pain. The chronic kidney disease is defined as a progressive reduction in renal function, so it doesn't develop quickly over months to years. The condition is irreversible and eventually affects all the organs of the body. Parenchyma and the nephrons are destroyed and the renal function progressively diminishes. Etiology, there are many causes of chronic kidney disease. The chronic kidney disease is a renal disease such as polycystic disease, arteriosclerosis, chronic glomerulonephritis. So this is a progressive reduction. So from time to time, it's to decrease the function of the kidney. And as I told you, it's silent, very common. Tuberculosis of the kidney, diabetes. So diabetes, if the patient has diabetes, it has increased chance of development of the chronic kidney disease. Hypertension, if this hypertension, so increased blood pressure, if it's not controlled, if the patient does not take medicine, renal calculi, renal stones can cause prostatic hypertrophy. Yeah. I'm sorry. Investigations. So urine analysis, of course, detection of blood urine, nitrogen, electrolyte, urine culture, renal biopsy can be also important, full blood count, renal ultrasound. So this is kind of classic things to diagnose urinary problems and kidney problems. We don't have time for this, I guess, here. So signs and symptoms. So I will not answer the phone. Sorry. So signs and symptoms of the chronic kidney disease. In early stages of disease, the patient may be asymptomatic. As the disease progresses, the patient may present with the following symptoms: lethargy, headache, breathlessness, proteinuria. Proteinuria, that means when the proteins are found in urine. Hematuria, we mentioned, this is when the blood is found in urine. Oliguria, anuria, we mentioned this. Symptoms of anemia. Why the patient of the chronic kidney disease may develop anemia? Solomon, what do you think? What can be the reason of the patient with chronic kidney disease to develop anemia? Renal blood. What do you think, man? So what can be the reason? Solomon? Yeah, you mentioned actually the function. Remember the function of the kidneys. So what are the function of the kidneys? And during kidney failure, when it cannot conduct those functions. So which function is important for the anemia, for the red blood cell production? Regulation of pH, but which one is but another one is directly connected to the red blood cell production, and we mentioned this. You mentioned this today. Yeah. Yes, man. This is about production of erythropoietin. Erythropoietin, this hormone, this substance, hormone actually, which regulates, which encourages the production of the red blood cells in normal cases. But if the chronic kidney failure develops, kidney cannot produce enough amount of erythropoietin, therefore anemia can be consequence. Okay, does it make sense? Because of this thing. So yeah, hypertension and pallor also. I know when you may be tired. So let's read. So chronic kidney disease is more common in people of South Asian origin, African or Caribbean people than the general population. The reasons for this include higher rates of diabetes among South Asian people and higher rates of high blood pressure in African or Caribbean people. Okay, man, this was about the kidney disease, chronic kidney disease. Now about the case. Can you read this case for us? Salwan, can you read the case? Okay, Salman left the chat. Yeah, I don't know why. Maybe internet problem. I hope. What should I do? Hmm. I don't know why he left. He did not say anything. Okay, he's back, I guess. Okay, man. As I say, it was the internet problem. You may be very tired also. I am also tired because all of this, lots of talking, lots of things. Yeah, network problem. I got it. Okay, man. Okay. So I will try to be slow, and have the active learning activities. But first of all, let's go through this case we have here. Can you read or should I read? Which one do you prefer? I can read also. I don't have problem. Mm-hmm. Mm-hmm. I lost you. I can't hear you, but yeah, I can listen. Are you talking now? Because it seems that you. But it shows me that you don't have turn on microphone. Okay, maybe that's problem because yeah, it had the problem. Okay, man. Okay, I will go through this. I'll go through this case. So we have the case. It's Mr. Lee Hong, which is a 38-year-old owner of small restaurant. He lives with his wife and their 2 children. One day while at work, Mr. Hong collapsed with severe pain around his kidney region. His wife, who was at work with him, called for an ambulance and Mr. Hong was rushed to the local hospital. On arrival at the emergency department, Mr. Hong was still in a lot of pain and asked the student nurse for a urinal to pass some urine. He passed approximately 100 milliliters of urine and gave it to the student nurse. The student nurse observed that Mr. Hong had blood in his urine. Mr. Hong was examined by the duty doctor and the provisional diagnosis of renal colic was made. Yeah, so renal provisional diagnosis was renal colic. This is very general name. So main symptoms was collapse, severe pain, decreased amount of urine production, and blood is in urine. So what was this vital signs? So temperature was normal, pulse was a little bit increased, it was increased 102. Respiration was a little bit increased. The blood pressure was decreased, actually, 92 decreased. Saturation was normal. White blood cell amount was little bit increased. It was increased. Neutrophils was increased. Lymphocytes was increased. Red blood cell amount was normal. Hemoglobin normal. Platelets normal. C-reactive protein, it was increased, but just 0.1. Urea was increased. Potassium normal. Sodium normal. So take some time to reflect on this case and then consider the following. Discuss the possible medications that may be prescribed for Mr. Hong. Explain the role of drugs you have identified. What advice would you offer Mr. Hong regarding his fluid and dietary intake? What advice would you give Mr. Hong to prevent future reoccurrence of this problem? Okay, let's go through this case and let's answer all this case. So this was renal colic, and one of the most common reasons of renal colic is the renal calculi, the stones in the renal system or conducting system. So stone in the ureter you see here, and you see the staghorn calculus, which is one type of calculus in the kidney. So renal calculi are stones, but actually, you know what, man? I would prefer if you search about renal calculi yourself on internet, and then you will describe what will you find, because it's better way for you to remember. So could you search and then explain to me a few words? What did you search about renal calculi? Solomon? Okay. Okay, man, you have 5 minutes. I give you 5 minutes to search about this topic. And then please explain me. You can type here or speak, I don't know. Just search different types of renal stones, reasons, symptoms, clinical management. Okay, use your time because it's better way to remember. They can be called kidney stones, and are solid masses made of crystals. Can develop anywhere along your urinary tract. Calculum, uric acid, sulfative, and cysteine. Yeah. Calcium, uric acid. Yeah, true. Okay, man. What about other information? What can be the symptoms, clinical manifestation, patients with renal stones? How can we identify it? What about treatment, cure, and management? Vomiting, definitely, it can be the important sign. What else? Nausea, exactly. Blood in urine, exactly, man. What else? Fever can be if the infection is also that. Yeah. And most important, severe pain if this stone is stuck. It has very severe pain. I myself used to have the stones, yeah. Yeah, frequently. I also had the stone stuck in ureter. It was severe pain, man. You can become crazy. Yeah, yeah. It's very bad. Yeah. Thank you so much. But it was very funny thing. Not funny actually, but strange thing. I was it was 3 years ago exactly, and I was exchange student. I was abroad, and I had this pain, and I did not identify it. That it was kidney pain. I was talking about it was it could be stomach pain because I had a stomach problem. I had these kind of problems, so I had very strange, severe pain. But somehow it go back, and then when I came back to Georgia, I had my classes at the university. It was ultrasound classes, and for showing other students how the ultrasound works, I was chosen as a patient. And when my lecturer did the ultrasound of the abdomen and the urinary tract, she found out the huge stone which was tucked in the ureter. Yeah, and then everything was obvious, and then I did operation. But I still remember this strange, very bad pain, and I don't know how I did not identify, and how can I live with this pain even without taking any medication. Okay, man. Okay, it's just what, yeah. No worries. Okay, so now, do you want to add something? Did you search anything else, or should I continue? And we will finish soon. After this renal stones, okay, we will finish. So, the renal calculi are stones in the urinary tract and are most common cause of upper urinary tract obstruction. Men are more at risk than women. So when it comes to the renal stones, women are higher risk. Stones may develop and obstruct any part of urinary tract. So what can be the reason? Dehydration. So if you don't drink enough amount of water, that could be the reason. That's why I always drinking water. Even here, when I have lecture, I try to drink 1.5, actually 2 liter of water, because it's best way to prevent the development of renal stones. Immobility, carcinoma, so cancer of the bone, urinary tract infection, excessive dietary intake of calcium, vitamin D, proteins, gout. You know about this disorder. We may speak about this one when we do discuss rheumatology. Hyperparathyroidism, family history of kidney stones. This is also important. So investigation, urine analysis, abdominal X-ray, ultrasound, intravenous pyelogram, full blood count, urine electrolytes detect electrolyte imbalance, cystoscopy. This is a cystoscopy, and we already watched the video how cystoscopy is done. So by the help of cystoscopy, you can find where the kidney stone is found. Intravenous urogram and intravenous pyelogram. This is important, but I think you can actually we have time to read this one. Okay, I will read for you what does intravenous urogram and intravenous pyelogram means. Intravenous urogram, intravenous pyelogram. So the test used to call an intravenous pyelogram. Intravenous means the injection is given into the vein. Pyelogram refers to images produced of the internal structures of the kidneys, the collecting systems, and the tubes leading from the kidneys to the bladder, the ureters. With newer techniques, it's possible to get better detail of the whole of the kidney, and the name was changed to urogram. However, both names and both abbreviations are used. An intravenous pyelogram is an X-ray examination of the kidneys, ureters, and urinary bladder that use iodinated contrast material injected into the veins. The intravenous pyelogram examination helps the doctors to assess abnormalities in the urinary system, as well as how quickly and efficiently the patient's system is able to handle fluid waste. There are the usual slight risks associated with ionizing radiation and also from the injection of the contrast medium. In particular, female patients who are not might be pregnant, who are or might be pregnant must inform a member of staff in advance. The injection for this test is generally very safe. However, with every injection of the contrast medium or dye, there is risk of reaction. It's not uncommon for people to feel a little warm as the contrast medium flows around the body. Some people may develop a rash, and a few people may get a mild asthma attack. Very, very rarely someone gets a severe allergic reaction similar to that with, for example, peanut allergy. There are no special preparations for an intravenous pyelogram. Nurses need to follow the protocol of the hospital and the safe preparation and care of patient going for IVP. I guess it would be better to show you the video. So I encourage you to search the video. You will get better because just reading is not enough. So signs and symptoms of the calculus. In early stages, the condition may be asymptomatic. The presenting symptoms depend on the location of the renal stones. Stones forming in the kidneys may go undetected for years until identified for routine abdominal X-ray. The patient with stones obstructing the ureters may present with colicky pain, very severe pain sometimes, hematuria, so blood in the urine, nausea and vomiting. Stones in the urinary bladder may not have any symptoms, except for a dull pain in the suprapubic region after voiding urine. Yeah, if these stones, so pain develops when the stone is stuck somewhere and cannot lead the urine to go through this. Okay, I know I'm talking too much and you could be tired, so I will not speak about care and management. I will tell you that one of the main way to prevent the urine production is to drink the water. Of course, the management, you should pay, the doctors are supposed to somehow make the stones to degrade. So there are different methods. Pharmacologically, analgesia for persistent pain, antibiotics to prevent development of urinary tract infection, and test your knowledge. Okay, man. Okay, man. I think we can finish it here. I spoke too much, and he was with me through these 3 hours. Thank you, man, for attending me. I'm still interested about Babit and Yazan. I hope they will watch the video and inform me how they are. Next week we will have tutorial on Wednesday, and we will speak about very important chapter. This is lung chapter. Lung chapters. This is about lung pulmonary system. So please read about the kidney chapter. Read it from the book, and next week we will assess your knowledge also, and we will speak about lung chapter. Thank you, Solomon. Have a good week, days. Bye bye. Okay, bye bye, man. If you don't have any question, we can finish it here.